Imagine the outrage. The BBC, funded by your hard-earned license fees, is set to spend a staggering £650,000 on top-tier private healthcare for its employees, while everyday folks battle epic waits just to see a doctor. It's a story that's got people boiling over, and trust me, you won't want to look away as it unfolds. But here's where it gets controversial. Is this just smart workforce management, or a slap in the face to the public footing the bill? Let's dive into the details with a bit more context, because for those new to how the BBC operates, the license fee is essentially a tax that every UK household with a TV must pay annually, around £159 these days. It's meant to keep the corporation running, broadcasting everything from news to entertainment for the masses. Yet, according to an exclusive report, the BBC is putting this money toward a tender for a contract worth £650,000. This would provide staff and contractors with convenient remote GP appointments, think online video calls or phone chats with doctors, anytime they need them. The deal kicks off in February 2026 and could stretch to January 2029, or even longer until 2031 if extended. Critics are furious, branding this move indefensible and demanding an end to the license fee altogether. Why? Picture this. Millions of people are stuck in long queues for NHS appointments. That's the UK's public health service, which is free at the point of use but often overwhelmed. Recently, data from NHS England, analysed by the House of Commons Library, revealed a shocking 12.9 million people waited over 28 days for a GP slot in the first half of the year, up from just 4.5 million back in 2021. And it's not just GPs. Non-urgent treatments led by specialists can drag on for up to 18 weeks after booking. For beginners, this means if you're not in an emergency, you might wait months for care that the BBC staff could access instantly via this private service. A source in the TV industry summed it up bluntly: when the public can't get a GP appointment for love nor money, our license fee is going on BBC staff getting one whenever they want. It's a joke. It really highlights the disparity, taxpayers funding perks for employees while they struggle with the same system. William Yarwood, media campaign manager at the Taxpayers Alliance, a group advocating for lower taxes, called it outrageous. He pointed out the two-tier system, where license fee payers are compelled to fund luxuries they can't enjoy themselves, showing how disconnected the BBC seems from everyday realities. The license fee should be scrapped, he urged, as it unfairly burdens families who are already tight on cash. And this is the part most people miss: the BBC's defense. A spokesperson explained that, as a round-the-clock global media outfit, many staff work odd hours or in remote locations without easy NHS access. Providing remote GP services is part of their duty of care to keep absences low and operations running smoothly for viewers. It's a counterpoint that could spark debate. Is this genuinely about employee well-being and efficiency, or an unnecessary extravagance? Critics argue it's prioritizing staff over the public, while supporters might say it's essential for a 24/7 operation. What do you think? This whole situation raises bigger questions about fairness and public funding. Should the BBC be allowed to use our money this way when so many are suffering with NHS waits? Does this justify scrapping the license fee, or is there a better way to reform it? We'd love to hear your thoughts, agree with the critics, or see the BBC's side. Drop your opinions in the comments below, and let's discuss.